Well, hi there, it's Mr. Bleeker here. Thanks for stopping by again. In lesson 2 of the excretory system, we'll focus in on hemodialysis, or the cleaning of the blood. Now, that necessitates that we determine why kidney dysfunction happens, what some of the remedies are, alternative ways of cleaning the blood. We'll look at a few of those, and really what leads to these conditions in the first place. If you go to lesson 2 here, you'll see really what we have are some animations and some discussion here about kidney transplantation, which will kind of be the last part of today's lecture. So away we go. Now, I've already got this set up for you. When you look at kidney dysfunction, one of the things I want to point out to you is exactly how the kidneys are plumbed. This structure right here, which I'll zoom in on, I put this picture on the course site because this is very informative anatomy. What you have here is the descending aorta, and that's plumbed into your left and your right kidneys proper, like that. Now, that is an extreme amount of pressure, and we've talked about how that pressure uh, from the descending aorta is spread out over the millions of nephrons and the surface area of the kidney. However, that is considerable pressure, and too much pressure. Let's just make this a little bigger here. There we go. Too much pressure is what we call hypertension. Hyper meaning too much, tension, of course, meaning pressure. You might have seen this arm cuff if you've been to the doctor. This is used to determine blood pressure, although you've probably seen machines in drugstores, even ones that'll go across the wrist because you can determine blood pressure here as well. Because there's so much pressure with each beat of the heart and the blood coming down the descending aorta, putting too much pressure on the kidneys is an issue. You can think of it this way. If there's too much fluid in the pipe, with each beat of the heart, there will be tremendous pressure applied on the kidneys. If the fluid volume in the descending aorta, or in general, is too high, your kidneys go under too much pressure even for them to bear. So high blood pressure is one of the causes of kidney failure. Another one can be diabetes. Now, if we look at a healthy kidney and we zoom in on um, the glomerulus and Bowman's capsule, we're looking at that structure right here in ultrafiltration. Normally, what would happen is some glucose, some amino acids, lots of water, etc., would get pushed or ultrafiltered through the glomerular knot into Bowman's capsule, and then you enter the proximal convoluted tubule right here. But in the case of diabetes, you get a complication where this structure here becomes leaky and you start to lose things that you really shouldn't be getting. In particular, you'll find a high quantity of protein in the urine. And basically, the glomerulus isn't functioning as it should. It's breaking down, and the kidney starts to experience basically failure right at the glomerular level. And if large structures like protein can get through the urine, that's a surefire sign that this is become far too leaky of a structure, and too much is getting into Bowman's capsule and then entering the nephron. And it can't be recaptured, not effectively. There's no mechanism by which the body will recapture protein. It doesn't really export that. A third mechanism of kidney failure is what you call polycystic kidney disease. Now, this is a genetic disorder where cysts form on the kidney and essentially disrupt the function not only of the cortex or the outer layer, but also of the medulla, uh, of course, which is deeper in the kidney structure proper. And the kidney just starts to break down, to fail, and urine doesn't flow down through the calyces into the pelvis as effectively. So essentially, these pyramids here, which represent the essential structures in the medulla, are impacted quite heavily, and the kidney ceases to function. Okay, so that's the bad news, that things like high blood pressure, diabetes, and polycystic kidney disease can affect your kidneys. So really, what are some solutions? If kidneys fail to function, then you've got some serious problems. You've got ammonia-like substances in the blood, which are created anytime you consume protein. And ammonia-like substances are quite basic and they need to be removed. Other things that, of course, need to be removed from the blood: excess water, excess salt, creatinine, basically everything we talked about in our first lecture. So, what's a remedy for this? Well, when you look at dialysis, now without showing the entire patient, it's quite a simple process. And if you've studied diffusion and osmosis, this should seem quite familiar. But we'll begin at the beginning. Here we go. Your blood is removed from your body and it's passed through a machine. Essentially, there's a pump. And your blood is brought very close to a membrane, semi-permeable membrane. And as it comes near this semi-permeable membrane, it starts to encounter this is called a cross-current mechanism. You pump the blood in this direction and you bring a fresh solution across the other way. Now, this fresh solution is known as dialysate. And the best way I describe this to students is almost think of this as blood plasma. Everything that's in blood, essentially, without the toxins. So this is very clean. As this is pumped across the membrane in this direction, the concentration of toxins in here is zero. There are no toxins. And through a process known as diffusion, the toxins will spread out from a region of high concentration into this region of low concentration. And the pumping mechanism forces the dialysate into basically a recovery system. And the idea is to keep dialysate flowing across the membrane, basically bringing it in a neighborly like way near the blood to convince the toxins to, by diffusion, flow into the clean dialysate. Now remember that diffusion is always the flow of particles from a very concentrated region, you can see it's very concentrated here, to an unconcentrated region. We've seen this at school a million times, folks. If someone sprays Axe body spray in the hallway, it will spread out from its concentrated region into the air, which is less concentrated. It takes a little while, but eventually, that overpowering smell overpowers us all. So the principle is the same, but I want to look at this with a little bit more detail. This mechanism here is, you would think that this mechanism is really just an interim solution. And well, the answer to that is kind of yes and kind of no. If a person's on dialysis, this procedure needs to be repeated many times per week. And you think taking the blood out of the body, the patient has to lie there, they have to be hooked up, the blood has to flow out, be cleaned, has to be returned to the patient. It's quite a process. I wanted to point out that just go to Google here, that there is a case of an individual, a Chinese man, who's kept himself alive. Actually, this would be old data. I think would be upwards of 15 years now with a homemade dialysis machine. So you could Google these characteristics here, and you'll come to the page I did, most likely. But really, what's being done here is this fellow has kidney failure and was never able to get a kidney transplant. What he's essentially done is whipped up a homebrew dialysis machine where his blood is extracted from his body. This here is what is called the dialyzer. So his blood is flowing past fresh fluid, sort of plasma-like fluid, and is being cleaned and returned to his body. So when you look at the cost, the reason why this man had to basically go with this system, one, he was unable to get a kidney, and two, the cost of treatment was inordinately high, and the treatment would have been at the hospital all the time. And if you've been to China, go to rural areas, it's not always feasible to just go into town, come back for treatment over and over again. So this is quite an inventive sort of system that he's done here, using a lot of gravity feed in place of sort of a dialyzer pump. If you're interested in that, just cross-reference these terms. I didn't know his name, but he's doing his own kidney dialysis here. So interesting story, worth looking into. Okay, we'll look at dialysis here. And of course, here's your kidneys, renal artery, uh, renal vein. So blood in, blood out. We kind of get the idea. And the process is to do your filtration and to get the toxins out. You want those to be to form urine, flow down the ureter, head to the bladder, and to be eliminated. I get that. I like this animation for a couple of reasons, because it shows the toxins, these little gray fellows here, flowing in, and those toxins being eliminated, of course, through the ureter. I mean, that's what it's all about. Now, this is where you refer to the purest blood in the body. At this point, what should be happening is you shouldn't have these little toxins, these little gray things. That's not what you want. And in the case of polycystic kidney disease, if you take a sample of blood leading back to the heart, you should be seeing this. This actually should have the cleanest blood in the body. Of course, this is the renal vein, which will hook up to the vena cava. So if a blood sample was taken from the inferior vena cava, it's inferior because it's below your heart, this should have the cleanest blood in the body. But if toxins are there, that's kind of a telltale sign the kidney's not functioning properly. And you can see how disruptive that this polycystic or many cysts of the kidney disease can be. Essentially, in this case, as you would see in similar cases with really high blood pressure affecting the kidneys or diabetes, you get things in your renal vein that shouldn't be there. They should be filtered out. They should have been flowing down the ureter and being eliminated from the body. So this poor unfortunate soul here is suffering from kidney disease. So the blood has to be taken from the body and then returned to the body once it's been cleaned. So enter the hemodialyzer. This is the apparatus right here, which will contain that dialysate, that clean fluid that will remove the toxins basically through the process of diffusion from the body. Not just toxins, but also excess water. Remember, the kidneys do eliminate excess water. It's not all about water conservation. You can have too much water. So just start up the animation here and just show as the blood flows in, the dialysate essentially flows in the opposite direction. That's a little bit more effective. And the dirty dialysate, in this case they're showing the dialysate in blue, the dialysate will be constantly removed. So you want to pump clean dialysate in, and of course be removing the dialysate. Now this emulates ultrafiltration in the kidneys, and we just have to do it with a machine in this case. Okay, there we go. Take a little zoom in on the really this dialysis process, and the dialysate is kept separate from the blood. The blood's flowing past it. The dialysate itself, of course, is going to be full of salt, water. It's basically like plasma, and it just doesn't have these toxins. So what I like about this animation is you can sort of see what the toxins are going to do. They can get across the semi-permeable membrane, but that membrane, like I say, is semi-permeable. It might let salt across until you form an equilibrium in salt particles. Okay, that's good. But if you think about it, all of the toxins are on this side. So there's a natural diffusion gradient. If they have a chance, they will try to spread out to form an equilibrium or to populate the other side initially here. And that's just diffusion in action right there. Now, that's not osmosis, and I'll tell you why. Because we're not talking about water. By these toxins, we're referring to creatinine. We could be referring to antibiotics in your blood. We could be referring to ammonia like substances, right? Like urea, things like that. And they will flow across as they try to form sort of a chemical equilibrium. The thing is, we keep whipping them away until they're gone. So we're actually using energy to remove them by pumping the dialysate over and over in a countercurrent way across the blood. So this would be a fresh round of dialysate, and we convince even more of these guys to come over. And you can see the cumulative effect is that your blood will be cleaned. And if we repeat the process several times, there you go. Essentially nice and clean. That blood is ready to go back into the patient's body, and you have accomplished a round of hemodialysis. Now, before I move on, I'm going to talk about a second form of dialysis here. Um, if you have kidney failure, one of the things your physician will do, they'll put you on a fairly low protein diet. And the reason for that is that it's hard enough to remove toxins from the blood. And things like urea, for example, we want to try to keep some of those things to a minimum. So a low protein diet often goes with kidney failure because that ammonia like substance, you really don't want that building up in the blood because the body doesn't have an effective way to get rid of it. And last time I checked, ammonia is quite basic and you really don't want that building up. Okay, this is an interesting version of hemodialysis that I actually wasn't aware of before a couple of years ago. It's where the body's abdominal cavity, hollow abdominal cavity itself, can be used as basically a filtering medium. Let me show you this. This is called the peritoneum right here, and it's full of blood vessels. Now, if you go to Wikipedia, there's a nice picture of it here. In blue, this is what we call a serous membrane lining the organs and lining the abdominal cavity, and it's called the peritoneal membrane. Okay, so it's a protective membrane, but it's also full of blood vessels. And if you bring great surface area blood vessels close to the abdominal cavity like this, what we have is a site of exchange. In other words, it's the blood vessels are so thin that toxins could flow out of the capillaries into this area. But what has to be done is the area needs to be filled with dialysate. So yes, we're basically going to fill up the abdominal cavity with dialysate. So what you see here is called a catheter. It's a tube that's inserted into the body. This is a permanent catheter, and dialysate is going to be injected into the abdominal cavity and then drained out. And the idea is that the dialysate will absorb the toxins from a really large surface area and be captured in the drainage. So let's take a look at that. So here's your infusion. So we'll pump the dialysate in, and there you go. And if you bring the blood vessels in contact with clean fluid, what will happen is, of course, they will do diffusion, and you eliminate your waste this way. There's a nice snapshot of those blood vessels in the abdominal cavity. They're tiny, and because they're tiny, they're very their thin little walls are just perfect for diffusion. So the toxins will, of course, flow into the fluid. It becomes polluted, so to speak. Concentrations become much higher. And the idea is to, well, take a little snapshot of it here. Those toxins will flow out into that fluid, into the abdominal cavity, and they're ready to be eliminated. Now, this process has to be repeated, but this is a little, having a permanent catheter like this is just another mechanism. Rather than taking the blood out of someone's arm and running it through a dialyzer, you can essentially use the abdominal cavity as the dialyzer. And you can see all those little toxins showing up, and they're about to get flushed. And there you go. They're gone. So they're in the drainage. Now it takes several applications to make this happen, but this peritoneal cavity that we're looking at here, um, the sort of the lower abdominal cavity, what we're looking at is just another mechanism for dialysis. And the process, this just shows the process has to be repeated. The catheter, of course, has to be hooked up and just repeat until the blood is clean. There you go. That's the idea. So you could do hemodialysis or peritoneal dialysis, um, but really you're waiting for kidney transplantation. And kidney transplantation is a fairly interesting procedure. One of the things people don't realize is that you really don't want to go carving into the patient to remove the kidneys. Even if they're not functioning, you don't want to introduce too much infection. So here's the existing kidneys, and here's the part you probably um, getting to it. This is what should be happening, of course. Nice, clean um, blood returning. In this case, we'd be looking at polycysticism, kidneys not functioning. So you've got the toxins, of course, going out through the renal vein. Not so good. Now, what can be done is you can transplant a third kidney. Now, zoom in a little bit here. I want to show you this. This kidney from a donor, a good reason to be an organ donor, saves lives. Its renal artery is grafted to the inferior vena cava, the renal vein is grafted to the inferior vena cava. The renal artery is grafted to the descending aorta. So it's plumbed just the way a kidney would be. And of course, its ureter is then plumbed down to the bladder, just the way it should be. It's just that you've got a third kidney. Now, this technique, these kidneys don't need to be removed. As I said, you don't want to introduce infection. Now, you need about 2/3 of a kidney at minimum tissue to do the job of filtering the blood, right? You wouldn't, obviously, you'd want to make sure that your patient isn't too active, because this kidney would have to obviously cleanse the blood, right? It would be doing a large amount of work, but one kidney can do what's required to keep a person alive. The problem with kidney transplants is your body can see them as foreign tissue, and your immune system, your white blood cells, your army of white blood cells, can attack the kidney. Now, it's pretty important to understand that your tissue is labeled for your body. It has very specific little proteins and sugar markers on the surface, and if you get a kidney from somebody else, it's not labeled the same way, and your body will identify it and potentially reject it. So here's a quick little crash course on what are called histocompatibility proteins. Human leukocyte antigens. There's little markers on the surface of your cells that your leukocytes, or white blood cells, will check out, and they need to be your proteins. Otherwise, your white blood cells will come along, like this little policeman here, and representing the immune system, but will come along and destroy those cells. If you remember lysosomes, you remember just what cells can do to destroy invaders. Fairly toxic. And if this process keeps up, that tissue begins to break down. So, of course, what happens? Well, you use drugs to tell the immune system to chill out, relax. And they're called immunosuppressant drugs, and it basically builds a little more time for the body potentially to accept the kidney. But again, if you introduce immunosuppressive drugs, you also increase the chance of infection in the body, because the immune system's a little bit blindfolded. It's a little dumbfounded. It's not doing its job like it normally does. So in this case, you're hoping that your immune system doesn't go after the kidney tissue and that the kidney transplant takes. To be successful in the transplant, First of all, you have to make sure that the organ comes from a person who has the same blood type as you. Now, my blood type is A negative, so we'll get more into blood types in the circulatory system. But a perfect match, of course, would be A negative. Um, I could also take O negative uh, organ types. My body wouldn't reject those, but getting a match, a good match, would be from a close family member, um, someone genetically who's similar to you. Otherwise, it becomes a little harder to find a match for you. Genetically, you want to be very similar to the donor. So this is really just sort of buying you time, right? Here they're saying it probably could last a year, but eventually the immune system, it may take out that organ. So you really want to be searching for a donor at this point, right? Otherwise, the person is going to be on hemodialysis or peritoneal dialysis until an organ can be found. There you go. So we're sort of back where we began. So you notice in this lecture, I didn't go back to the notes, and the reason for that was dialysis isn't really a topic that I cover in the notes. I just wanted to make sure that you had a good tour of dialysis, the two forms, hemodialysis and peritoneal dialysis. So I'm going to keep it short and sweet. This is one of my shorter ones. Thanks for popping by, and we'll see you again. Have a good one.